Good afternoon, everyone, and thank you so much for joining. I'm happy to see we have so many of you here today. My name is Alina Lesu, and I'm the project manager supporting share care projects with our division. And we have here three of the members of the Iron Infusion Clinic at Jean Patterson today. So Harvinder Delay, the manager of the Iron Infusion Clinic, Ravinder Paul, the clinical nurse educator, and Tess Perez, the patient care coordinator. They will be providing us a presentation as an overview of the clinic, and then we're going to have about 10 minutes for questions. Um, can you move the slide, please? I would also like to acknowledge that we host this presentation on the ancestral and traditional territory of the Coast Salish people, specifically the Kwantlen, Semiahmoo, Tuasin, Kitsi, Kwikwantlen, Kaikate, and numerous Stolo First Nations. Next. A little bit of details for the housekeeping today. Please turn on your camera. We would really like to see your face today. In case you signed in with just a simple name, please try to rename and change your name to your full name, so Joanne can ensure that she's sending the session, the credits to the proper person. And please mute yourself if you're not speaking. There is feel free to use the chat box at any time, and feel free to raise hands. I actually have a hand raised. Yes, Dr. Rajdeep Nirvan. Is that the hand raised? Okay. Moving forward, regarding the credits, you will be receiving the credits after you complete the evaluation at the end. So at the end, we're going to post a link in the chat, and please just complete the survey to be able to receive the credits. They will be coming via email from Joanne, as well as the along with the voucher for the food. Okay, so passing on to you guys, Harvinder, your turn.
Thank you. Hi, good afternoon, everyone. Thank you for having us go over a little bit of medical data. My name is Harvinder. I'm the manager. Next to me is Tess, our PCC, and Ravi is on the line as well, our CNE. So for today's presentation, we'll just give a brief overview of medical daycare and the services we provide, and what is an iron infusion, how do you make a referral, and how are the referrals triaged, what are some common issues with referrals that we receive, what does a typical patient journey look like, and what are our clinic contact information and locations, and it'll all be followed with some questions and answers. So medical daycare is an outpatient clinic providing medical treatment to ambulatory patients 17 and above that do not require hospitalization. We provide services primarily to patients residing in Surrey and North Delta. For BC Cancer Agency patients, we'll see all patients throughout the Fraser Health region. If you have patients under the age of 17, please refer them to BC Children's. So some of the services we provide is IV therapy, blood product transfusion, PICC access, Foley catheter change, big teaching, BCC installation, portacat access, antibiotic IV therapy, and phlebotomy. That's not our extensive list, but just some of the main things we offer.
Sorry, just a second, Harvinder. Is there a way to speak a little bit louder, because it seems like they cannot hear you well?
Does that help a little bit?
Not particularly. It's actually really muffled on this side. And in the chat, there's a number of physicians who are really, we're not able to hear you clearly at all. So I know for myself, actually, I missed what was being said for the previous slides because we couldn't hear.
Did that help?
I think it's better.
That's wonderful. Thank you.
Okay. So do you want me to just start from the beginning?
If you wouldn't
Yes,
mind.
please. Yes,
Thank
please.
you.
Sorry. Okay, so for today's presentation, we'll be going over the services provided in medical daycare and what an iron infusion is, how to make a referral for an iron infusion, how are iron infusion referrals triaged, common issues with referrals, a little summary of the patient's journey, clinic contact information and location, followed by questions and answers. So medical daycare is an outpatient clinic providing medical treatment to ambulatory patients 17 and older that do not require hospitalization. We provide services primarily to patients residing in Surrey and North Delta. Patients for the BC Cancer Agency will see all of the patients residing in Fraser Health. If a patient is under the age of 17, please refer them to BC Children's Hospital. So some of the services we provide is IV therapy, blood product transfusion therapy, PICC access, Foley catheter change, SCIG, BCG installation, portacath access, antibiotic IV therapy, infusions, and phlebotomy. Our current hours are Monday to Friday, 7 o'clock to 2000. On weekends and stats, we're open from 9 to 1700. We're really excited to announce as of June 2024, I believe on June 7, 2024, we will be expanding our hours from 7 o'clock to 22:30, 7 days a week. So that will build a lot of capacity and help with some of our wait lists. So what is an iron infusion? An iron infusion is a way to receive iron through an IV. If your blood doesn't have enough iron, your body cannot make enough hemoglobin. Hemoglobin is a protein that carries carries oxygen throughout your body. So with low iron causing low hemoglobin, it's known as iron deficiency anemia, one of the most common types of anemia. And so we've mentioned a few of the reasons you'll have low iron. One thing to note is IV iron therapy is not considered a routine treatment as per BC guidelines. So Ravi's just going to go over the referral pathway.
Hello, everyone. Can you hear me okay? All right. It's nice to see you all in this lunch hour. I'm just going to quickly go through the referral process of the iron infusion. So we have a website. It's called medicalstafffraserhealth.ca. This medical staff website can be accessed from outside the Fraser Health, which is you all can access this website. All the referral forms and the pre-printed orders can be found in this Fraser Health website. So from this Fraser Health website, we did a really, really good job pairing them or combining all the referral forms and the required document in each service we provide. So in iron infusion, there is an iron IV iron pack. We need a medical daycare referral form and also regional pre-printed order for that. So if you go on with this website and click on the link, JPOCSC clinics and services forums, then choose the relevant, whatever you guys want to refer to. So all the forms need to be printed and filled and faxed to us. Okay, so how to make a referral? Again, we go to the website, fill up all the forms, and fax them to us. Please note, we don't accept walk-in patients. All the referral has to be completed physician and sent to us. Then we will contact the patient for their appointment. Please, we still getting old referrals forms. So please do not save these forms on your desktop and print the new form from the website, because we update them as we update all the PPEOs or referral forms. So that's also delay your referral booking. Okay. So there's two forms under iron. Can you go back to, yes, thank you. There's two forms in the IVRN pack. Referral form, number one is a referral form. There is 2 pages. Sometimes we get only 1 page and there is no signature of the physicians. So please fill the both forms and pre-printed order. And a pre-printed order is your prescription. That need a physician's signature on it, and fill the complete form. Sometimes we get the dose, but no how often you should give. So that delay your referral. So all the physicians can refer to iron infusion as long as they have MSP number or the billing code eligible for the refer. No specialist required to refer for this service. And the dosing, please refer to the BC guidelines. Next page, please. So again, when we get the referral from physicians, we receive it, we make sure it's complete. And if it's not complete, we send that referral back to physician's office requesting missing information. The referral does not move forward if there is incomplete information. So I can't stress enough to complete this form in order to get that going. Okay, any incomplete referral or missing information, you will receive that, and you have to complete appropriate forms and all the requirement forms. Then we send that referral to pharmacy, and pharmacy, if you meet the criteria, pharmacy will send us back those forms. If it declined, then pharmacy will send the notification to the physician and telling them why it's not, why it's declined or why it's not approved. If it's approved, they send us, then we book the appointment for the patient. So there is 2 priorities: urgent priority and a routine priority. Urgent booked within 1 to 2 days, weeks, and routine priority will be booked within 2 to 3 months. And the priority criteria is a MSP check the box. This is urgent, and BC Cancer Agency referrals are all urgent. And ferritin is critically low and patient is symptomatic, then it's urgent. The pregnant with critically low ferritin is urgent, and patient scheduled for surgery has low ferritin level, hemoglobin level, they're urgent. All right, so we send referral to pharmacy, receive referral from medical daycare, and pharmacist to review recent blood work within 2 months for the hemoglobin and ferritin levels and confirm if patient meet the criteria. In a couple slide downs, we will go over the criteria. So that's another problem we were having. Blood work is not within 2 months. Sometimes blood work is 6-month-old or year-old. We can't process your referral because it has to be within 2 months. So if a patient meet the criteria, then referral sent back to medical daycare, we book appointment for the patient. If it does not meet the criteria, then then pharmacist will fax to MRP explaining why any iron source of iron is not approved. Not just monoferric, any iron is not approved. Then also will provide you other alternatives. Okay. So if it doesn't approve, if patient does not approve for any source of iron infusion, monoferric or vinifer, then if a physician feels that patient still need iron clinically, so then patient need to buy their own supply. Then medical daycare will infuse. If you want to proceed with that type of request, then you have to connect directly to the pharmacist, and they will take care of that. So there are some issues with iron infusion referrals. Common one are these: incomplete referral form and PPOs. As I mentioned, a lot of them are incomplete. Like for example, today we received a referral for phlebotomy. There was everything else is there, but they didn't write how much blood should be removed. So we had to send that back. So it's incomplete PPOs. Missing patient information, demographic, identifiers. As you all know, that we can't process referral because we don't know who are we doing for. So there's no patient demographics, identifiers. We can't process those referrals. Missing allergy status. We need to know if patient is allergic to anything before we give the medication. Pharmacy usually call to physician's office, find out the allergy status, then they can't get hold of the physician, so there is a delay. Unassigned referral. So a referral need to be assigned or PPO need to be assigned because that's your prescription. And MSP and other College of Physicians and Surgeons required all the paper need to be assigned or as prescription need to be signed. And we cannot process those referrals. Missing date. All of our referrals are good for a year. If you are referring patient for 1 year iron infusion, and if we don't know the date when the referral was sent, then we can't tell when it's 1 year old. We need a new referral. Missing blood work or blood work is not completed the last 2 months. That's the big one as well. We don't know if they're improved or declined more. So we need to know their latest blood work. Next slide, please. So if patient does not meet the criteria, pharmacy reviewed this criteria. They they usually go over the blood work. So if patient did not tolerate oral iron intake or was poor response, this is for vinifer, and one of the following has to meet the criteria. So ferritin should be less than 50 microgram per liter, or iron saturation less than 20%, or hemoglobin less than 110 gram per liter. If it's within this, then we can order the iron sucrose. For the monoferric, again, you have to try oral intake first. If they're not tolerating, their poor response to oral intake, then their hemoglobin is less than 110 gram per liter, and ferritin less than 30 microgram per liter. This information all on the on the PPOs, by the way. And ferritin less than 30 or ferritin less than 200 and saturation less than 20%. So that's the criteria pharmacy looking for. If a patient does not meet any of those criteria, they will give you option if patient can buy their own, or one way or the other you can order. A little bit about the patient journey. So when we receive the valid order, process gone through, is approved, we call the patient and book their appointment. And the patient receive a reminder call 1 day before the appointment, and we provide them where the location is, where the parking is, and we recommend to bring meal if it's a longer appointment. Then if they have any question, we have a patient care coordinator and in charge nurses, they can answer their questions. Then patient arrive and check in within the reception, and they receive the armband for identification. Then nurse meet them and perform initial assessment, start their IV, and start their treatment. And we follow them as per Fraser Health protocols, and check their vital signs, check their sign of reaction to the medication or treatment, and complete their treatment safely. And after completing this treatment, if they have a more appointment coming up, we tell them you have appointment this day, then they come back. We book them right away. And when they finish their treatment, we send a fax to physician that this patient completed their iron treatment or whatever treatment, and we discharge him from the clinic. Just to know, you know that they're completed, and if they need further, you need to contact us again. And if there is any issue with the treatment, so our PPO has a built-in hypersensitivity and anaphylaxis reaction management. If you have not checked that, if something happened, because we don't have any physician available or connected to the clinic, so all the physicians are referring physicians are primary. So we need to contact you guys. If something happened and it did not mention in the PPO what we need to do, like for example, give them Benadryl or give them epinephrine, or give them basically the anaphylaxis management, then we send them to emergency if we can't get hold of you. Okay. Jim Patterson, we are located on level V in the Jim Patterson building. Phone numbers are there, fax numbers there, and you will get the copy of this presentation as well. Thank you. That's all I have. If anybody has a question, please feel free to unmute yourself and ask the question.
Thank you, Ravi.
No problem.
Can I ask a question?
Yeah.
So I'm just two things. One, we like to update our patient charts on our end for the nurse practitioners when they come in or when we send out the referrals. Is there a way that it could be acknowledged once the referral form is received?
At this point, due to the volume of referrals we receive, we don't have the capacity. We're hoping when our EMR system is upgraded, there may be a better way to provide that feedback once we've received the referral.
Thank you. And then just secondly, what about wait times right now? What is the general wait time for Jim Patterson?
It depends on the service. For irons, we're looking at 2 to 3 months. With our expanded hours in June, we're hoping that will start to come down.
Thank you very much.
There are other questions in the chat as well. So some Dr. Harvinder Dillon is asking whether the forms, your forms are, referral forms are on Pathways.
Yes. Yeah. They are on the Pathways. And I clarify with my colleague today, there are PPOs and referral forms. They're up to date.
I have a question. Can I ask?
Yes,
I
of
don't
course.
have a camera on my desktop. Sorry about that.
It's okay.
This forms, is it possible instead of having 3 forms, signing on every page, if you make it a single page, that will be easy for us so you don't miss the second page or third page. A single PDF file with the signature on the last end. And that'll be much easier for us to handle it and send it back to you. That'll also reduce the redundancy of patient information on every page and everything. That'll be of great help. You've done a good job. Initially, you guys had, I used to fill 6 pages instead of phlebotomy pages, everything together. Now we've reduced it to 3 pages. I would be happy to see it's a single PDF file, easy to handle for the doctors to send it back so that there's no missing pages.
Yeah, thank you for that feedback. So regionally, all of the medical daycare and ambulatory daycare clinics are meeting together to work on a better referral form that works for the divisions, as we've kind of received similar feedback.
And also one more suggestion to remove all the redundant forms on the web. Sometimes we urgently search, we come across the old forms. If you can remove all the old forms and infusion, that'll be great too.
Okay. On the Fraser Health staff website, we shouldn't have any old forms in the medical daycare folder, because we recently updated them.
Okay.
Another question in the chat, which came up a couple times, is there an acknowledgement of the referral form that it's sent out to the family physician? And also another, once the treatment or the infusion is completed?
So that question was asked earlier as well. So no, there is no acknowledgement that we've received your fax at this point, just because of the sheer volume, and it would be a manual process. So we are hoping that our new EMR that we are waiting to upgrade to will have that capability where we can acknowledge. At this point, just due to the volume, it's just not a manageable process. For completion of treatment, yes, we do notify the physician that the treatment has been completed, and we also indicate on that notification if a further treatment is required, please send in our new referral. Normally, we will let you know a few treatments in advance that the treatment is expiring.
Yeah. For example, if they have one treatment left and your order is more than a year going to be for next appointment, so we send you a notification or fax you for the new referral forms, because we can't treat them with that prescription because it's 1 year old. That process is in place.
And another question, thank you, Ravi, is whether there is an option to make just one page for the referral form so they won't miss the second page, because it's a 2 pages.
Yeah, so it's actually 2 pages plus a third PPO. The PPO is a regional form that is used internally and externally in the hospital and in the outpatient setting. So unfortunately, we're very limited on what we can do with that, but our referral form for sure, as I mentioned earlier, we're working with the other ambulatory daycares just so everybody's using a similar form and gathering feedback. As soon as we start working on that process, we will be connecting with the divisions for feedback on how we can improve those forms.
Thank you, Harvinder. And one last question. Dr. Maria Anderson asking whether there's an information that can be put to be contacted in case of a reaction, or if the patient is getting their infusion like sent to ER, that she's not receiving the.
Our first option when we encounter any reaction is we contact the MRP. If the MRP we cannot get a hold of them, then we do manage them with the pre-printed like reaction order, because at the bottom there's all the medications that we would give. If we cannot resolve, we would connect with the MRP. If we couldn't get a hold of the MRP and the reaction wasn't resolved, and that's when we send them to ER.
Thank you, Terry. Okay.
Alina, are you going to be compiling these questions and sharing them back with the Iron Infusion Clinic? Because there were a number of questions in the chat that didn't get, we didn't have time to answer.
Yes, most probably we will take them all and then bring them back to the team at the Iron Infusion Clinic. I just put in the chat the link to complete the evaluation for our session today. So please just take a minute or less than a minute to fill that in and let us know how that went for you. I thank you so very much, and I hope this was a valuable use for your time. And I wish you a nice day ahead.